employer questions and employee questions, I should say, questions about small business loans, and just helping as much as possible be a resource and a service to everyone in the community as we work through this together. As we all know, there's no rule book or playbook for this. And so what we've been committed to doing over the past several weeks is being available around the clock to our constituents, and I couldn't do my job effectively without them. So today, as we hear from you, I and all of them are taking notes. If we have answers to your questions today, we're going to provide answers. Admittedly, there's so much going on, so many developments, and this is so complex that there are some questions to which we'll need to take notes and go find answers to. But Sharon, if people want to ask questions on the call, we'll take notes. And if you want to send us questions afterwards, you can go to my website and jeffleach.com, and there my cell phone number and email are there to get in touch with me and my staff. So let me just say at the outset that if you would have told me, let's say 8 weeks ago, 2 months ago, during spring break, when my kids who are here in Allen schools, Brady, Charlotte, and Landry, at Green Elementary, that the last day they would go to school this year would be the Friday they left for spring break, that they wouldn't be returning to campus, that our colleges and universities would be closed, that churches would be essentially closed, moving all their services online, restaurants would be closed except for takeout and delivery. If you would have told me all of this, that we would have over 1 million Texans file for unemployment benefits, over 2.6 billion paid out in unemployment in a span of just 7 to 8 weeks, I'm not sure I would have believed you. I'm not sure any of us would have. But at the same time, and I hope you'll hear me on this, that if you would have told me that in response to all of that, in response to this crisis and in response to these dark times, the people of Texas, and especially the people in Collin County, that we would rise up and meet this challenge and look out for our neighbors and hunker down in our own homes, looking out for ourselves and our families and those around us, trying to slow the spread of COVID-19 and defeat this terrible virus. If you would have told me at that time that Texans would rise up to meet the challenge, I wouldn't have doubted you for 1 second. That's exactly what Texans have done in a very, very unique way. This virus is a terribly aggressive virus. It does discriminate against certain age groups and certain demographics, something we all know and something we're all concerned about, specifically folks 65 and older. There's also data that we're getting in that it is especially prevalent in certain ethnic communities, specifically African Americans and Hispanics, something we're very concerned about and we're watchful of. The data does not lie, that this is a terrible virus that we need to treat very, very seriously. Every single day, if not every day, every other day at the very least, I've been in regular communication with our hospital CEOs here locally, our medical experts, our health professionals, doctors, asking and trying to figure out, wrap my arms around, along with our counterparts at the federal and local level, what our hospital capacity looks like in terms of bed availability, ventilator availability. We've been on track of that on a daily basis because everything we've been doing, the heightened hygiene habits, the staying at home, sheltering in place, the social distancing, all of that has been in the effort, as you know, to slow the spread, not necessarily to beat COVID-19, but to slow the spread, to protect our hospitals and our healthcare systems. And because of you and your work, because of what you've done and the folks across the state of Texas have done, taking that seriously over the past several weeks, we have been able to do that. The projections look good. The trend lines are positive. And so we are able to, while continuing to focus on the health and the safety of every single Texan, especially those vulnerable populations, we're able to start rolling out Texans back to work. The economic damage, the economic catastrophe, I think we could call it, as a result of COVID-19 is very, very real. It has affected businesses of all sizes. It has affected businesses all across the nation. It's affected businesses that we thought there's no way you could touch them, that they were impenetrable. It breaks my heart, and I know it breaks yours as well, when I have constituents call me, constituents who normally were able to shop at Kroger here on Alma and McDermott or go out to eat at any number of restaurants here locally, take their family out to eat. Those same folks are now in lines at the North Texas Food Bank. because they've lost their jobs and they've expended their savings, and that breaks all of our heart and it rattles our conscience. And so to the extent that we're able to continue to protect the health and safety of all Texans and continue to slow the spread and protect the healthcare system, but at the same time get Texas back to work, we are committed to achieving both of those goals, the physical health of Texas and the fiscal health of Texans at the same time. So the governor this week released the first phase of 3 phases of his Open Texas plan. I imagine all of you are vaguely familiar with it. We are actually have been working around the clock with constituents, business owners, and employees here in our district to try to make sense of exactly what this plan means. As I mentioned earlier, some questions are easy to answer. Some direction is very clear. And there are other questions, there are other issues that are a bit more vague and complex and frankly concerning. And so we are working around the clock to figure out exactly what this means for our district. So for instance, if a restaurant owner, let me break this down in simple terms, for any essential service that has still been operating here over the past several weeks. So you meet the governmental definition of an essential service and you've still been operating. Maybe you've been out of your office, but you've still been working, maybe working from home or working remotely. Construction, for instance, healthcare, legal services that serve essential businesses. There's a whole list of essential services that can continue. Home building is one of them. Grocery stores, pharmacies. Nothing in this order necessarily changes anything that essential services have been doing for the past several weeks. What this does do is it adds to essential services a list of additional services that can now operate at a 25% maximum capacity. So restaurants who have been doing takeout and delivery over the past several weeks, and by the way, many restaurants have literally singularly been able to survive because of the generosity of folks in our district. Instead of cooking at home, ordering takeout and delivery. So thank you for those of you that have supported restaurants like Two Rows and Fillmore Pub in Plano and other restaurants. Anna Sophia's here in our backyard. Literally, I had the Miguel, the owner of Anna Sophia's restaurant off Alma and McDermott, tell me the other night that the generosity, the outpouring of love and support for their restaurant has overwhelmed them. And so thank you. And that's just one story of many. Now those restaurants can reopen. Movie theaters can, if they want to, reopen. We can get into that in a little bit. At 25% capacity for the next couple weeks until May 18th. And then it's expected on May 18th that the governor will issue a new order, increasing that to 50% capacity. And then going forward, possibly even more than that. In addition, medical offices, certain non-necessary medical procedures can now go forward. Dental offices should be opening on Friday with certain restrictions. Other medical offices and services that may have not been essential, elective surgeries, if you will now be reopening on Friday as well. Outdoor sports, as long as it's no contact, and outdoor sports that are limited to 4 or less people. So we're not back to football practice quite yet, or soccer practice or basketball quite yet, but tennis and golf, other sports, outdoors, and 4 or less participants can go forward. That's the highlights of the order. I will tell you that before I'm going to be quiet and then I'm going to take questions because I know I've rattled on, and Sharon, hopefully I've hit on the major highlights of what this means. I will tell you that there are certain things in the governor's order that I strongly agree with. I've been communicating on behalf of our constituents, employers, and employees with the governor's office on a daily basis for the past several weeks, and I'm real happy with certain parts of it. There are other parts of the order that are a bit more concerning to me, in full disclosure, and I'm actually sending, for instance, a letter to the governor today on behalf of barbers, nail salons, hair salon owners, personal trainers who are left out of this order. They are not allowed to reopen yet. Not only do I know you're looking at me and you're like, man, he needs to get his hair cut and his beard trimmed, and you're right, I do. But I want to go to my guy and do it instead of allowing my son, or with all due respect to my wife, who's right here as well, allow her to cut my hair. So we need to get those people back to work. And frankly, for instance, our barbers and our nail salons, many of them, like our doctors and our dentists, are uniquely and highly trained to sanitize their equipment, sanitize their tools, to make sure that their environment is safe to operate in. They can take reservations. They can control who comes in and out. They can wear masks or gloves. I believe that the governor, and I'm actually asking the governor to reconsider that, to let them get back to work. I've heard from many of them, dozens of them over the past several days here in our own district who want to get back to work and believe they can do so in a safe way. Let me close with this. That no one is required to go back to work right now. Yes, we are trying to get Texas open again. We believe that that's necessary not only for the fiscal health of our state, but there are certain physical benefits. There's also physical consequences that come with folks being out of work. The suicide rate has spiked. The rate of child abuse across the state, even in our community, has spiked as people are out of work and staying home. Those are things that should concern us. At the same time, I want to make very clear that if you want to stay home, I encourage you to continue to stay home. All of us need to continue to be socially distanced, to practice clean hygiene habits, to wash our hands, yes, to wear masks if you want to when you're out in public, and if you're a business owner, to require your customers to wear masks. Those are good things. But please hear me that if you're 65 or older, or if if you find yourself in one of the highly vulnerable populations to COVID-19, please continue, if you're able, to the extent you're able, to stay home. We're going to continue to slow the spread of COVID-19 to ultimately beat it. Yes, hopefully a vaccine is coming down the road. Some therapeutic remedies are coming hopefully sooner down the road within the next few months, but no one is required to go back to work. We're simply allowing folks who believe that they can operate a safe and healthy working environment to do so, for the benefit of all Texans, for the benefit of our neighbors. So Sharon, with that, I apologize for rambling, but this is a highly complex, very detailed, often confusing order, and I wanted to try to hit the highlights. I'd be happy and eager, in fact, to take questions, and I'm going to be taking notes here as I hear from people. Sharon, I think you might be muted.
Unmute me. Like
There
I said,
you go.
I'm not a professional at this, but anyway, I was just thanking you for your comments and wanted to now open it up to questions. So as I mentioned earlier, let's try to use those little wavy hands down under the reaction at the bottom. So if you have a question or a comment that you'd like to share, if you'll do that, like I just did, then I'm happy to unmute you. Y'all are very quiet. I don't see anybody asking any questions. Casey would like to ask a question. All right, Casey. Casey, maybe you need
Hey, Casey.
Okay, there you go.
I'm sorry I missed the first couple of minutes. I couldn't log on, but I have a question that maybe you might have already addressed. If there is testing for people today, you get a test today and you are negative, how long does that negative protection give you? You could get the virus tomorrow or the next day, or you could be tested positive how long is the protection that when you are deemed negative? How long does that last?
So it's a great question. I want to be clear at the outset here that I am not offering you medical advice or legal advice to anyone necessarily, but I know just enough to make me dangerous, as I've learned over the past 8 weeks about testing. I will tell you that as we go forward, increasing the amount of testing is so important to controlling the spread of COVID-19. We are working diligently with our counterparts at the federal and local level to increase the amount of tests. But you're exactly right. Just because you get a negative test it means you don't have it currently, but it doesn't mean you won't necessarily get it. Right now, because of the limited amount of tests, if you have the symptoms right now, if you meet certain symptoms, and if your physician orders you to get a test, it's very likely you're going to be able to get a test, but that doesn't mean necessarily that you won't get it. And so what we're trying to do is for folks that are getting tests and that test negative, to encourage those folks to continue to do the things necessary to keep themselves safe going forward, especially if they're in vulnerable populations. So maybe wear a mask, socially distance, don't go back to work unless you have to, continue to stay at home. And hopefully our healthcare system will continue to be non-overwhelmed. So if you need to get another test down the road, if you exhibit symptoms again, you can be able to get that test. I hope that answered your question.
So it's only for
And if
those,
it didn't, then
it's only for those right now who are symptomatic or who might be nervous or want to be reassured, but there's really no reason to be tested if you're feeling good or nobody in your family is sick or you haven't met up with anybody who's sick. I mean, I don't understand the point in, even the governor was saying to be tested, but nobody can tell me why if you're not symptomatic.
so if you're, well, a lot of folks have had COVID-19 and were never symptomatic,
Right.
but they could have still transmitted it to other folks. And so you could be at work when you go out into the community, you could be around folks who have COVID-19 but don't know they have it. And that's something that all of us should be concerned about. I want to encourage you to call your physician, rely on the advice and counsel of your personal physician. That's what we've gotten a lot of calls from folks who want to get tested but don't have symptoms. They just want the peace of mind. And I get it. If there were 30 million tests in Texas, I'd love to go get one of them. Sharon, can you still hear me?
Yes.
Okay, all right. But the fact of the matter right now is the number of tests nationwide is fairly limited. That's changing on a daily basis as we get more tests, but rely on your physician. That's my one piece of counsel to you as your friend and state rep.
Thank you.
Anyone else? Comments, questions? Just unmute yourself and jump in. Lauren.
Hi. So Jeff, you said that if you don't want to go back to work, or if you feel uncomfortable, if you're a compromised population, a member of, you have an immune deficiency or something like that, that you encourage people to continue to stay home. However, if your employer decides to open up and your job is available and you want to continue staying home, do you qualify to continue receiving unemployment?
So that's a great question, Lauren. Thank you for asking. We've had a number of other folks ask us that as well. If you've been laid off from your job and have gone and received unemployment benefits from the Texas Workforce Commission, so you're currently receiving unemployment benefits plus a federal $600 federal supplement, which will continue until July 25th. If your employer offers you what the law is a suitable offer of employment, if you receive from that employer a suitable offer of employment to come back to work, and you, for whatever reason, refuse to come back to work, there can be an instance in which your employer can communicate with the Texas Workforce Commission and the employee can lose unemployment benefits. I frankly am concerned that we've got some folks, not many, but there have been some reports of folks who frankly are making more from unemployment benefits with the $600 supplement than they ever were in their other jobs, and are choosing to not go back to work for the next few months because they think that $600 supplement will continue into perpetuity. There's some misinformation out there that $600 supplement, which is real valuable to a lot of folks, is going to continue on for at least another year. That is not true. That's misinformation. Right now, that $600 supplement is scheduled to end on July 25th. And so there is law, and Texas Workforce Commission is advising employers that if you want to go back to work, if you want to reopen, if a restaurant, for instance, wants to offer that waiter who's been laid off their job back and that waiter refuses, then they are at risk of losing unemployment benefits. Lauren, I hope that answered your question.
Neil, I think you had a question.
I did. It's more of a comment. Jeff, I appreciate your positive stance on a situation that's beyond our control, but I also want to shout out to, I see Shelley George on the line. The city has been very responsive. The videos they put out with the mayor and the fire chief, and it's been different than our neighboring communities. It's been positive. It's been, how are we going to work together versus, we're going to catch them doing something wrong. And Shelley, let the city know we appreciate that.
Yeah, Neil, I want to echo that. Shelley and Lauren, you as well. I'm not sure if there's any other city council members or if the mayor's on, but the city has just been so wonderful. So has the school district. Let me give a special word of recognition and a shout out to Robin Bullock, our superintendent at Allen, her entire team, her cabinet, and all of our educators, that they have, like I said earlier, there's no rule book for this. There's no playbook for this. There's no guide for our educators as to what happened when schools are essentially shut down in the middle of a school year. And our educators across the state, but really in Allen, and I represent Plano too, and I was on a call with Sarah Bonzer in the Plano chamber this morning and said the same thing. They have been amazing. They've been amazing. Our educators are always amazing. Becky and I have been homeschooling our kids for the past 8 weeks. And Lauren, I think you may be in the same boat. I know that Julie and Mary and some others on the call are, and I've always loved and respected our educators, but that has gone to a whole other level here over the past 8 weeks as Becky, with my help, has homeschooled our kids. I'm the PE teacher. So thank you to Robin Bullock and her team.
Anyone else with any comments or questions? Just unmute yourself and ask.
I'd also love to hear if there's any folks on the call, Sharon, who have concerns either with the governor's order or where this is headed. I mean, if you're hearing stuff, this is a great opportunity for I and my team to hear from you so we can advocate effectively on behalf of our district. So we'll take questions, happy to do so. But if there's other folks who just want to talk to us, we're happy to hear that as well.
Jeff? Did you have a question?
Who were you asking?
You.
Oh, Shep? Yes. Hi, thank you.
Yep.
Yeah. Hi, Representative Leach. Thank you for arranging this and participating and sharing your points of view. I work in a business that's in several states, and gotta say, I love the way our state and local leaders have managed what is arguably otherwise unmanageable, but led to the best of your abilities and allowed others to lead to the best of theirs. And kudos to the governor's office and to the county and the city and the chamber for everybody's dedicated efforts with striving so diligently without really knowing, what the ultimate answer, ultimate outcome is. I really loved Judge Hill's order that needed to be rescinded, where he talked about all business is essential, and his encouragement to Governor Abbott to view as such. I will tell you, one of the states in which we operate is Montana, and they've had much more of a centralized mandate than Texas. But as now, there are as many people in our county here in Allen and Fairview than there are in the entire state of Montana. So circumstances and facts are, entirely different and incredibly relevant. But one of the things, as Montana is easing, is with respect to the barbers and the salons, and one solution that they've come up with, that despite not being too enthused about many of their edicts being from the center, this one seemed to be pretty reasonable. And it is that they opened up. Actually next week they're opening the salons and barbershops, and with the instructions that the barber or the cutter and the cuttee both wear a mask, and that then becomes a single station, a two-person station, and then that station needs to be socially distanced from any other stations in the establishment. So 6+ feet from center, and despite some other again centralized edicts that may not be quite as supportive of business, that one is one that I thought was pretty clever solution, and just maybe to be considered if in conversations back with the governor's office. That seemed like a very rational and responsible. Again, population differences matter, and population density differences matter. But I thought that was good, and I didn't know if you thought that might be something that would be at least worth discussing in your conversations.
Well, yeah. So thank you for those comments. And yes, we have got to get creative and innovative. And at the end of the day, as much as we want to protect the health of every single Texan, we're going to have to get to a point sooner than later where we've got to trust folks. We've got to trust property owners, business owners, employers, and employees to protect themselves and those that are around them. I'll tell you an anecdote that had me really concerned. A couple of days ago, I talked with a gentleman who owns a property in Allen. He owns a barbershop right off McDermott and 75 in where the shopping center there where Chuck E. Cheese is. And he owns that. He's leasing that space there from a landlord that's a New York company, a large multinational company. He's leasing that space, but then all of his barbers are independent contractors. They're 1099 employees. And so he doesn't make money if they're not working. He can't pay his rent if they're not working, which means he can't feed his family if they're not working. They clearly can't feed their families as well, which means that the landlord, out-of-state landlord, can come in and seek to threaten him and evict him. And that's frankly what they're doing. And it's caused a lot of consternation for me. The police chief and Bain Brooks are working with me on that. But there's no reason that we can't, within certain restrictions, allow that owner of that barbershop and his employees to create an environment where they're safe, they're protected, they're healthy, in consultation with our locals at the city level. And then customers have the freedom to go in under those conditions or not. So that's just one anecdote of many we've heard. But there's some personal trainers in our area as well that want to get back to personal training in their gyms and staying 10 feet away from folks, sanitizing the equipment after every use. And right now, under current law, they're not allowed to do so. And I'm just not comfortable with that. So we're working to try to get those people under certain conditions back to work.
And if I may follow up, the independent contractor really is a wrinkle for that gentleman with the barbershop, because with the government's, PPP, Paycheck Protection Plan, the independent contractor's wages, so to speak, really aren't to be counted. So he can't even, if he doesn't have a average monthly payroll, he can't get the PPP to be able to pay the rent because of independent contractors. And I think that probably fell through the cracks and was not an intended outcome of that. But that's a real problem.
Yeah, it is. Thanks for your comments.
Anyone else?
Jeff, this is Buzz Colby. Question, could you speak more about the mental health issues that are going on right now and what the Texas Health and Human Services Commission is doing? Because I read recently there's been a 500% increase in volume with them.
Buzz, I didn't interrupt you, did I?
You're good.
Okay. It should concern all of us. It's we've gotten reports that, like I said, incidences of child abuse are through the roof. The rates of suicide statewide, not necessarily in our own backyard, but statewide, have seen a spike. Interestingly, crime has stayed about level. I just got a number, by the way, sent to me that in our district, for those of you who are interested, that so House District 67 is about 190,000 people, give or take a few thousand. And we have had to date, out of 190,000 people, 8,182 people file for unemployment in our district within the past, I think, 8 weeks. If my staff needs to correct me on that, please do. 8,182 new folks over the past 8 weeks in our district who are out of work. And so physical health is important. Mental health is as well, Buzz. I totally hear you. I mean, I think we've just got to, as much as possible, try to get folks back on their feet, stay on their feet, and back on their feet. Thank you to our churches as well. I know we've got a couple faith leaders on here who've been working hand in hand with us to serve the community. I also want to mention HHSC is offering some free mental health services that we've made available. Anyone can call 24/7. And Sharon, if you let me, I'd like to send you a link to that service to folks to share with their neighbors, their employees, their networks. It's a service the state is providing 24/7 mental health consultation during this difficult time.
Thank you. Thank you, Jeff.
Jeff,
Yes.
this is David Hicks. Thank you very much for your leadership and your communication here. I very much appreciate that. And also just wanted to weigh some support on the, I don't believe in opening up Gold's Gym or 24-hour fitness or the big gyms, but I think personal training gyms where people are training one-on-one or two-on-one and they're able to maintain distancing and they're able to sanitize. My personal feeling is they should be allowed to operate, and people should individually decide whether they want to go train with their trainer or do a video training session at home or something.
Yeah.
And I really appreciate your balanced approach toward things here. I feel that we have an attitude as some of our elected leaders that seems to be coming out in the last week or 10 days that, well, we're kind of in the clear and we need to get everybody back to work. And I'm hearing more conversations from our elected officials about how to get back to work than what is really going on with this virus that we don't understand, we're learning about every day. And so I think that while it's not required to stay at home and we're not locking everybody down the way they did in New Zealand or the way they have in China or different countries, I really think that we should balance the messages about from medical professionals, from scientists, and blending the science with the desire to get back to work, because I'm really concerned about a resurgence in the fall. I'm concerned about what they've learned in New York about the 30 and 40-year-olds who are suffering huge increases in the percentage of strokes. They're finding that this is not just a respiratory illness, but something that's causing blood clotting and all sorts of different things. And it's just not dangerous to people who are over 65. You know, somebody just died in Dallas County who was 17 years old. So yeah, we've got to be telling people that, guys, we haven't experienced it in Allen and we haven't experienced it in Collin County to the extent that some of the other areas have that are denser. However, I still think we're perhaps still on the uphill slide or slope. So I'm a little bit concerned about that. And I think we ought to be making sure that we're getting that message out from the scientific community as well. And then finally, could you comment on antibody testing? I was traveling in January and February and came down with a 2-week cough and didn't have a fever and that sort of thing, but we're kind of convinced that maybe we were exposed and maybe had a mild case of it. So can you comment on antibody testing? Thank you.
Yes, David, thank you. Thanks for all you do for Allen, and it's great to hear from you. And be assured that at least for me and my team, I don't want to speak for any other elected official, but for me and my team, we are relying so heavily, almost entirely on data and doctors. Of course, we have our principles about what we believe in. Those don't change, but they're informed by the data and doctors. And I too am concerned and cognizant of the fact that there could be a second wave. And oftentimes, if you look throughout history, the second wave is sometimes worse than the first. I don't want us to go too fast and go too far and get out over our skis where we're going to have to retreat and pull back. And so that's why I'm supportive of the governor's approach to take this phased-in approach. There's some folks, all of us know this. Some of them might be on this call who want to open Texas up totally right now and be back to normal and have a bright green light. And I just think while I understand that sentiment, I think that's a mistake, and that's not informed by the data nor the doctors. As for your antibody question, David, it's interesting you asked that because we're seeing more sites pop up offering the antibody test. In fact, one of my good buddies here, Becky and I live here in Twin Creeks in Allen, right off Alma and McDermott. One of my good buddies here who is a personal trainer, one of those personal trainers I talked to, he had the exact same story. His wife actually went overseas on a trip. I think she was in Peru, came back and had a really terrible case of the flu, but it didn't meet the normal flu symptoms. It kind of met the COVID-19 symptoms, trouble breathing and all the symptoms that we're hearing about for COVID-19. She ultimately got over it, but he was scratching his head over the past few weeks thinking, man, was I possibly exposed? And so just yesterday, maybe the day before, he went and got an antibody test, and just a prick of the finger, a blood test, and within 10 minutes, it was confirmed to him that he did not have COVID-19. Those tests are starting to be available more and more throughout the community. I do want to caution folks to be very careful about going to non-reputable places, non-reputable providers. A lot of people, maybe I shouldn't say a lot, but some folks want to take advantage of these situations and do nefarious things. And so make sure that you call your doctor, and if you want an antibody test, find a reputable provider that's going to be able to give you solid information and counsel and medical data.
Hey, Jeff.
Antibody tests, though, are good. If you got the antibody, yeah, David. David, go ahead.
LabCorp, by the way, will be offering antibody testing, and also LabCorp will be offering antibody testing through Walgreens. I just saw something in an email yesterday on that.
Okay.
But you're right.
You
I
can
think
count on that being
something like 6 out of 10 of the antibody tests that are being advertised out there are actually showing false positives and are, just like you say, not reputable.
Jeff, this is
That's
Jeff.
putting it nicely. Hey, Jeff, how you doing?
How you doing, Jeff? I just want to say thank you for your leadership, from your realistic perspective, for your vision, and for your focus on taking care of the folks in this part of Texas. And I just thank you for your leadership. But my focus is my question and my thoughts is more towards education. And of course, this is speculative from your perspective, or a vision from your perspective. You are now homeschooling. A lot of the parents are homeschooling, and a lot of the parents are also homeschooling, but they're also teaching online. So there's a significant amount of stress associated with that, trying to manage their own children and also trying to manage the children and teach online as well. You did mention that part of the country and part of the state, domestic violence, family stress, everyone is confined to one location, can't go anywhere. But my focus is the vision and the speculative nature. What is it going to look like at these major universities and at our public and private schools come August? I do know major universities are primarily obviously teaching online. Some of the students' mindset right now, I can do this at home. I don't need to attend a college campus to get my bachelor's degree. And students right now at high school, at primary and secondary, are being educated and facilitated online. And the comfort zone is when the schools do open back up, or if they open back up in August. This is all speculative in nature. And then if they do decide what's going to be the apprehensive of a child or of a parent, you being a father of small children, are you going to be comfortable sending your children back to that public environment and that gathering again? So this is kind of speculative in nature, but I want to get your perspective on that. And what's the conversations being talked about at TEA, and what's being talked about at the Institution of Higher Learning for what it's going to look like come August of this year?
Jeff, it's a great question. Thank you. And admittedly, honestly, we could probably have a full hour-long call just on the issue of education alone. And in fact, Sharon, we might want to do that at some point over the summer as we look forward to the school year, because these are all legit concerns. They're concerns that I, as a parent and a policymaker, have. I do believe that we're going to be back to school in the fall. My hope is that we're going to be on schedule, opening back up in the fall. But there's parents even here in our district, not put the colleges, higher education aside, there's parents in our district who have big concerns about going back, sending their kids back to Allen High School with 5,000 other folks in a large group setting like that. And TEA has the same concerns. But having said that, Robin Bullock and her team here locally, we're working hand in hand in partnership with them, with TEA, and again with the medical experts to try to make sure we get this right. That's one of the reasons, Jeff, it's so important that we continue to do everything we can to slow the spread of COVID-19. We're not going to beat COVID-19 by the start of the school year. There might be some therapeutic remedies that are available by the end of the summer. Our hope is that they are, especially to help vulnerable populations. But this is something that's going to be ongoing. Speculative, as you word is used, is the right word. We're speculating on a lot of this, unfortunately. But the framework is in place to, if we're coming back, we're going to come back safely. And if we've got to continue to offer online learning in some form or fashion, we'll do that as well. With respect to higher education, I know that some of our universities Private universities like Baylor University, SMU, they've come out with their plan to come back to campus in the fall. University of Texas system, I don't know if UTD is involved in this, and I don't know if Amanda Rockhow's on the call today. If you are, Amanda, you might want to comment. But UTD, Austin at least, plans to come back, but they're only offering some courses in person, and they're going to offer some courses online. Some of you are asking the question, what about football? What about sports? What about volleyball and basketball and athletic events, whether it's University of Texas football or Dallas Cowboys or Allen Eagles? We don't know yet. We just don't know yet, and we hope to have those answers sooner than later.
Jeff, there's a question on chat from Denise Gomez with Children's Health, and she basically wants to know, as you look into the future on what the next legislative session will hold, what are your insights on the priority areas that you and your colleagues are likely to focus on given our current COVID-19 situation? Many citizens were hoping that we could build on the wins made on education and health. What challenges do you foresee as you approach the next session?
I think it's going to be the most challenging session in Texas in our lifetime, possibly in the history of our state. Our state has never been hit. Look, two years ago, we came back in, not 2 years ago, in 2019, that session was after Hurricane Harvey in 2017, which was the costliest natural disaster in the history of our country. Hurricane Harvey was. And we came into the 2019 session even after Hurricane Harvey, and we had plenty of money because the economy was booming. So we're able to invest substantially in education and healthcare and other areas. That may not be the case in 2021. We're going to have some very, very real and severe budget challenges that we're going to have to address head on. Having said that, I will tell you this. Texas is uniquely situated among all other states. We've got nearly $10 billion in our rainy day fund. We've got a budget that we've planned for going forward. We're going to have we were planning to have a little bit extra. We may not have extra, but our deficit may not be as big as some other states are facing. We've planned accordingly, so to speak. But I'll tell you this, House Bill 3, which was our education bill from last session, I co-authored that bill. So much of that bill, while it was not perfect, was so good for Allen and Plano and school districts all across the state, for our educators and our kids, and for you, for our community. And my goal above any other goal when it comes to our budget is to make sure that we preserve and protect those gains that we were able to achieve in House Bill 3. What a travesty it would be if we let this current crisis, as dark and as real as it is, have a lasting generational effect on our state and on our students. So we're going to have to prioritize. We're going to have to make some tough decisions. But my hope, Sharon, in closing this answer is that when we get back to work, when we get rocking and rolling against the state, our economy will come roaring back. And I believe that we've got the framework and the foundation to do just that.
Thank you, Jeff. And thank you, Denise, for that question.
And thank you for your work at Children's. You guys have just been unbelievable. So has Allen Presbyterian, and all the hospitals have just been so wonderful. So thank you.
Shep, did you have another comment?
I had just another quick follow-up question, if I could. Jeff, we hear newly hearing an increased urgency or concern, and it's probably not that new for those living it, of strain on the on the food supply chain and in agricultural supply chain, whether it's beef or pork or farmers, and would very much appreciate your point of view on what, if anything, we individually as well as collectively could do to help alleviate that. It's such a strange combination of circumstances. Governor Abbott and others, I'm sure, had the very visionary idea of having restaurants be able to sell some of their food supplies direct to consumers, but trying to help ranchers. Hey, let me buy one of your beef cattle or one of your pigs. I mean, what is there anything we can do to help alleviate what is increasingly emerging as a significant challenge or future headwind, if not threat, to the food supply chain.
Well, yeah, I think first that Lauren, you and the council, and Shelley, y'all should start, instead of chickens in our backyards, let us start having cattle in our backyards all throughout Allen. I'm of course joking on that. I think, look, it's a very real concern when we talk about our food supply, our food chain. By the way, there's so many restaurants locally. Bain Brooks is the gold standard when it comes to this, but there's so many like him who are keeping their restaurants open for takeout and delivery, not only to serve their customers, but to help their vendors, to help their suppliers. Many of them are supporting local farmers. For instance, Becky and I went a couple weeks ago to 60 Vines in Plano, one of our favorite restaurants, although outside the district, and they're staying open really to support their local farmers. And without those restaurants staying open, without our grocery stores continuing to place orders, those local farmers across the state would be out of business. So I believe that Shep, President Trump, don't quote me on this, but I did read something this morning in my news briefs that President Trump today or tomorrow is going to be issuing an order regarding the food supply, keeping our food chain open, providing some additional supplementation of federal funding to our agriculture community. I think that order may be coming down from the federal government sooner than later, but your concern is not lost on me. We've got to make sure our grocery stores stayed stocked and that people keep shopping, but that people have the money to keep shopping. It's all tied together. Hope that answered your question.
Yes, thank you.
If there are no other comments or questions, then we will let Jeff, if you don't mind, just kind of giving us a little wrap up and some words of wisdom,
yeah,
encouragement would be great.
Yeah. Okay. So Sharon, thank you for all of you. I know that some folks say this, but when I say it, I really mean it. We are truly in this together. I and my staff, we rely on you, our community partners, our elected leaders, our private sector, our educators, our neighbors. We rely on you. And so if you have additional questions you weren't able to ask today, or if you have comments or concerns, here's the one thing I want everyone on this call to remember, if you don't remember anything else. My cell phone is easily accessible. I'll give it to you now, but you can also go to my website and get it. And when I tell you my cell phone's accessible, this is it right here. I've only got one. I guess some politicians have more than one cell phone. You know, they got burner cell phones. This is it. So call me anytime. I'm available around the clock to help you, and my staff is as well. We literally love this and love partnering with you. So it's 469-855-0417. Again, that's 469-855-0417. Call me anytime. God bless each of you, and I look forward to seeing you soon, but not too soon.
Thank you again. We really appreciate everything. We appreciate all of you that were on the call. Jeff, we appreciate your comments and your leadership always. So y'all have a great day. Stay safe. Wear your mask. And we'll talk to you again soon.
Thank you.
Thank you.
Thank you.